Okay, there's kind of some cheesy ways of drawing this stuff. You can draw little cartoons. You can make your own little drawings. What I'm going to do is show you a couple that you can find on the internet. You can do your own. So this little guy. So you have the 1 in the center. So 1. Then you have the eyes are 2. There's 2. Then the 3 up here, showing it as eyebrows, but actually that's the ocular motor. So it's actually controlling a bunch of muscles around the eye. Then 4. So the Abducens Nerve, so it abducts the eye. And then, where did they put 5 on here? Oh, 5 is all around the face here. So it's all sensory. You can see 5. And then 6 is here. And 7 is facial. So 6 abducens. What do I call it? Did I call 4 abducens? Sorry, 4 is a trochlear, 6 is abducens, 7 facial, 8 acoustic or vestibulocochlear, 9 glossopharyngeal, which is down here, and then 10. They're showing that the back of the throat. It really actually goes down into his chest and abdomen, and then 11. They're showing it on the shoulders because you can shrug your shoulders, and then 12 the hypoglossal. So it's showing on the front part of the tongue here as well as. It should be also back down the throat too. So next slide. So here we are. I found this on the internet and nursing, a thing called Nursing Study Helps. But the problem is parts of this are wrong. 4, 6, and 10. 4 is actually superior to the eye. The reason they did this was they wanted to remind themselves that nerve 4 helps your eye look down. 6 allows your eye to look side, but they put it like down on the side, so it really should be a little bit more up than that. So, although and then the cranial nerve 10 is the vagus nerve, so they put that on the tongue, so it's kind of weird. So it should actually be down in the abdominal or thoracic areas. So I redid the slides. That's what the next slide is. And so I put 4 and 6 up near the eye where I thought they should be. And then move 10, the vagus nerve, back to the back of the throat, just to indicate that it's going down and is not isn't innervating things that are there. It's supposed to go down in the thorax and abdomen. Okay, next slide. Okay. Here's another way of looking at it. You have the olfactory, optic, ocular, motor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, smile, accessory, and hypoglossal nerves. So see and smell are 1 and 2, and look around 3, 4, and 6. Pupils large and small, number 3. Clench your teeth, number 5. Smile and hear, 7 and 8. Then say ah, number 9. See if you can swallow, 10. If you're left in doubt, stick your tongue out, 11 and 12. There's different ways of remembering these, and so you can draw goofy little pictures yourself, and they will help. All right, next slide. Here's another table just showing the location of origin. We already talked about that earlier, so I'm not going to go over this slide at all. So next slide. Okay, one other mnemonic that I want to leave you with for remembering the 6 extrinsic, meaning muscles that are external to the eye, that are innervated by cranial nerves 3, 4, and 6, is LR6SO4. So that sounds like what's meant to be it sounds like a chemical formula. So LR6SO4. So SO4 is sulfate. So if you ever take chemistry, you will recognize SO4. It's a very common ion that's in chemistry. So the lateral rectus, the LR, is innervated by cranial nerve number 6, and the superior oblique, SO, is innervated by cranial nerve number 4. And then all the other extrinsic muscles of the eye are innervated by cranial nerve number 3. So there you go. So lateral rectus, superior oblique is the trochlear. Lateral rectus abducts the eye, so that's abducens. Cranial nerve 3 is oculomotor nerve. And the muscles that cranial nerve number 3, oculomotor nerve, innervates are the inferior oblique, the superior, medial, and inferior rectus muscles. Cranial nerve figure 3 also innervates the levator palpebrae superioris, which is eyelid muscle, so it brings your eyelid up. So, and then ciliary muscles change in shape of lens, as well as iris muscles, which dilate the pupil. Okay, next slide. So here I'm going to go through some cadaver diagrams, just cadaver pictures, showing you all the cranial nerves and where they're located within the skull, and where they would exit. So this is the cribriform plate of the ethmoid bone right there. So you'd have the olfactory nerve number 1 would be coming along the top, and you'd have the little fibers sticking down through the olfactory foramina, and that's what this shows over here on the right, is the olfactory bulb with the fibers sticking down into the nasal mucosa. These fibers, these are fascicles. So those are, so remember, fascicle is a bundle of axons. So these aren't right at the beginning part, are not individual nerve fibers. They're bundles of nerve fibers, and then those branch and go into all and branch, and so you have a whole bunch of sensory receptors on the ends of all those axons when those fibers spread out in the nasal mucosa. Next slide. Okay, here's the eyeball. You can see that there. And then coming in the back of the eye, here is the optic nerve there. So, and on the right, you can see a diagram that showing the optic chiasma here. And we have some crossed and uncrossed fibers coming across the, so some fibers go to the same side, and some cross over and go to different parts of the eye. So you don't have to worry about the rest of that slide. I just want to show you what it looks like, the optic nerve coming in the back of the eye. Okay, next slide. Okay, I want to show you guys this diagram of the eye. This is the right eye, and showing the different muscles. There's 6 muscles that are innervated by these 3 nerves. The ocular motor, let's see, I'll start with the trochlear nerve, does the superior oblique, so that's cranial nerve number 4. And the abducens nerve does the lateral rectus, that's cranial nerve number 6 over here. So the rectus means flat muscle, so it's a flat muscle. So we have the lateral rectus and the medial rectus, and the superior rectus and the inferior rectus. Okay, so you have one on top, one on bottom, and one on either side, right? So lateral rectus, medial rectus turns eye that way. Superior and inferior rectus turn the eye up and down. Okay, then you have 2 muscles that are on the oblique, so catty corner to these other muscles, and we have the superior oblique up here and the inferior oblique down here. So the superior oblique, let me talk about the other muscles first before I get ahead of myself. So the superior rectus is cranial nerve number 3. The medial rectus is cranial nerve number 3. The inferior rectus is cranial nerve number 3, and the inferior oblique is cranial nerve number 3. So you can see all those different muscles are innervated by these different nerves. And notice up here, this is the trochlea. So that's what this little loop, this little tendinous loop is here. So the tendon for the superior oblique muscle comes through this little loop and then wraps around, and so it attaches on the upside of the eye, and you can see a little piece of it, right, of that tendon attaching to the top of the eye back behind the superior rectus muscle. So what it does, when it yanks on the eye, in this right eye picture, it's going to, you can see the arrow, and it's going to rotate the eye. The inferior oblique is going to rotate the eye up. So the superior rectus muscle actually, it's kind of weird, but makes your eye look down, and the inferior one makes your eye rotate up. And it's actually called extorsion. It doesn't like move up and down. It rotates and moves up and down. So I'm just describing this. You don't have to know this, but I want you to get an idea that this is. I'm going to show you some pictures later on of what some nerve damage to these things looks like in patients. So, but what I wanted you to see was that there are 4 muscles: superior rectus, medial rectus, inferior rectus, and the inferior oblique that are innervated by the ocular motor. The trochlear has the superior oblique all by itself, and the abducens has a lateral rectus muscle all by itself. Okay, next slide. Okay, so I wanted to show you that was previous slide was a anterior view of the eye. This is a lateral view of the eye, and so the trochlear nerve doing the superior oblique muscle here, Abducens nerve doing the around the back here, Abducens nerve doing the lateral rectus muscle there, and that was cut, and so there's the front part of the lateral rectus muscle is there. And then the ocular motor taking care of all the rest of them. So the superior rectus, inferior rectus, superior rectus, inferior oblique, and then there's a medial rectus that you can't see because that's on the, we're looking at the lateral side of the eye. So that would be there's the medial rectus actually. It actually is shown on here. Then there's the ciliary muscles of the eye, and there's also for the ocular motor and the levator palpebrae superioris muscle, which lifts up the upper eyelid, as you can see right there. So there's the innervations from the ocular motor nerve 3, cranial nerve 3, trochlear nerve, cranial nerve number 4, and abducens nerve, cranial nerve number 6. Okay, and all right, next slide. So this is just another view of the ocular motor nerve, emphasizing again the various muscles that it innervates, the ciliary muscles, as well as the sphincter pupillae, which makes the pupil contract. Okay, next slide. So here's a cadaver showing the trochlear nerve and the superior oblique. So here's superior oblique and the trochlear nerve together, so you can see them coming together up here, and the eyeball will be the eyeballs up there. So, and the here's a little levator palpebrae superioris muscle that's going to the upper eyelid there. So that's the upper eyelid. It's going to be up here, and superior rectus muscle here. So we're looking down on the top of the eye here, and from a posterior view looking towards the front of the face. And the frontal nerve down here, just to point that out, that's a large branch of the ophthalmic division of the trigeminal nerve. So you don't have to know that. I'm just pointing out why that's there. Okay, next slide. Okay, here now we're going to move on to we've done 1, 2, 3, 4, and 6. So now we're going to do the trigeminal nerve, cranial nerve number 5. So here's the ophthalmic branch. So the trigeminal nerve, ophthalmic branch, the maxillary branch, and the mandibular branch. So we have the number, this is 5, 1, and this is 5, 2, and this is 5, 3. And so you can see the ophthalmic branch goes up in and around the eye kind of region. The maxillary branch goes around the maxilla, and it goes into the alveoli, each alveolus for the teeth. And the mandibular branch goes down and innervates the lower jaw and goes up into the mandibula, into the alveoli of the teeth in the mandible. So that's where you get your nerves for your teeth nerves. It's from those. You also get a branch for a lingual branch, a tongue branch there as well. And anything else? Yeah, so that's main bits about so you have the ophthalmic branch of the trigeminal nerve, maxillary branch, and the mandibular branch of the trigeminal nerve. Next slide. Here's so these are all sensory innervations from the cranial nerve 5. So we have the ophthalmic division does this part up here. So this is 5, 1, and the maxillary division of the trigeminal nerve is 5, 2, and the mandibular division of branch of the trigeminal nerve is 5, 3, showing where those go. Okay, next slide. And this is a cadaver showing just part of the trigeminal nerve. This is the mandibular branch here. They took it and they cut it. Oops, sorry. They cut it, and then they reflected it back up. So they pulled it back up so it kind of showed the underside there. Okay, next slide. Abducens nerve. This is showing the lacrimal gland there, lateral rectus muscle, and the abducens nerve. So the abducens nerve is going to come in, so we're looking at the top of the eye and the lateral rectus muscle here, and then the abducens nerve going right along with the cranial nerve 6 going right along with the lateral rectus muscle, and it touches the muscle and then innervates it so it can pull the eye to the side. So we're looking at the the right side from the superior view, so the top view looking down on the eyeball. So this would be the right eye, and so that lateral rectus muscle is going to move it laterally. Then it abducts the eye, points the eye away from the midline of the body. Okay, next slide. Okay, here's cranial nerve number 7, the facial nerve, and so just showing you on this cadaver, it comes out of the stylomastoid foramen and then branches, and this is all underneath the parotid gland that you see here, and so these are all branches of the facial nerve there. So okay, so lateral side of the face, so right about here. And one of the problems that you notice, so if you ever have an issue with the parotid gland and you need to do surgery on that, you can't cut too deep. If you cut too deep, you could damage those nerves, and then you would lose muscle control of facial muscles. So you always have to be really careful if you're doing surgery on the parotid gland or in and around that area, because these nerves are not that deep. Next slide. Here's facial nerve again. The parotid gland's been removed, and you can see facial nerve here, labeled there, and then we have branches, branch here and branch here. So you have the temporal branches, zygomatic branches, buccal, cheek. Remember way back in the very beginning we talked about buccal, and then this is an artery right here. This is a facial artery, and then we have branches of facial nerve down here, and then some cervical branches. Cervical branch meaning neck. So, okay, next slide. The vestibulocochlear nerve. So here's your ear, the auricle of the ear, the pinna is out here, is this part out here. And then we have the auditory ossicles, we talked about those, the malleus, incus, and stapes. Then we have the semicircular canals, the vestibule, and the cochlea. So that's all for cochlea for hearing, and the vestibule with the semicircular canals for balance. And then we have the stapes right there. And so that's pressing on the oval window, going back and forth, making vibrations in there so that you can hear. And then we have the nerve right here. So that's your vestibulocochlear nerve, that yellow right there. So here's on the outside, there's your eardrum is there. So the eardrum goes back and forth. The malleus, incus, and stapes are moving back and forth, and so when the eardrum vibrates, it's transferring that vibration to what's called the oval window of the ear, and then that causes movement inside the vestibule and down through the cochlea, and so you hear things, and by hearing, those vibrations are turned into impulses that transmit down the vestibulocochlear nerve to the brain. Okay, next slide. Here's the glossopharyngeal, vagus, and hypoglossal nerves. I've got some cadavers of those, diagrams or pictures of those coming up, but I want to show you these before we got to those. So here's your hypoglossal nerve, and your vagus nerve, and your glossopharyngeal nerve, right next to each other coming down. So the vagus nerve is that middle one there, so it's heading down. Heading on down. The hypoglossal nerve is this one here, and so it heads down, then it branches, and you see it going over here towards the tongue. And then we have the glossopharyngeal down here, and it is heading down and going in the back down here. There, so okay. Next slide. So we have Glossopharyngeal Nerve 9, Vagus Nerve 10, Accessory Nerve number 11. And that's so the picture of those. Here's the Glossopharyngeal and the Vagus Nerve there. And then the Accessory Nerve is there, which you can't see it. It's back behind me. Next slide. Here's Glossopharyngeal Nerve. Cut away a lot of the skull. Look, here's the tongue and some teeth over here on the left side, on the patient's left side, cadaver's left side. So there's your glossopharyngeal nerve being pulled up with the probe. Number 9. All right, next slide. Glossopharyngeal nerve number 9, once again. So this is a frontal section through the musculature and in and around the spinal cord there. Okay, next slide. These are big old fat arteries here, there and there. So, next slide.